Next up in Better Health, we head down to Invercargill and introduce you to the Return to Nursing course offered by the Southern District Health Board.
My name is Maria Baines and I'm the Return to Nurse Educator for Southern DHB Southland site. So we run a Return to Nursing program here at the Southland site for Southern DHB. So Nursing Council of New Zealand require that if you're out of practice for 5 years or over that you do a Return to Nursing program, or a competence assessment program as it is called in other areas. And we run one down here on the Southland site for our local nurses. We differ from the competence assessment program where we just do locally trained nurses or New Zealand trained nurses, so we don't fit the criteria for internationally trained nurses. We do this so that we can get our local nurses back into nursing and provide a platform for them to do it in a nice and supportive way. We get plenty of inquiries every year. Often people take 2 or 3 years to actually decide to come on the course. I may get inquiries from the same person for 3 years in a row before they get on. What we do is we have an application process where you go online, you download the application and you send it in hard copy, and we look at your application case by case basis. So we look at where you've worked in the past, how long you've been out, and whether the course is appropriate for you. If you haven't nursed for very long, say a year or 2 years, and then took 10-20 years out, this course might not be appropriate for you because there's a short time frame that you have to prove your competence for Nursing Council and for your assessor. One of our success stories is Sarah Dermody, who was away from nursing for 7 years to have her children, and she's come back and done her clinical placement in the children's ward where she is going to be returning as a casual nurse here.
I'm Sarah Dermody and I graduated as a registered nurse in year 2000, and then I left in 2006 to have my first baby. I then moved to the UK for 5 years, so after 7 years I decided to return, and so I've just completed this August, just gone. Well, after having my children, I'd been at home with them. My oldest was 7 and my youngest 3.5. I just decided it was time to get back into it, and I missed the nursing. The course was fantastic. I found all the staff very supportive, from first with Maria right through to my preceptor on the ward situation. I was really nervous about going back into acute nursing, but with everybody's support it was much easier than I anticipated, and yeah, it was a great experience and so pleased to have done it now.
Well, you can do it full-time or part-time. So if you do it full-time, you can start at woe to go in about 5 weeks. That's quite intensive and it can be quite full on for people coming back into nursing, especially if they've got families or they're currently holding down jobs. So we do a part-time option as well. The theory dates are set in stone and you have to attend those 10 theory days.
I found the theory days as part of the Return to Nursing fantastic. It was the most up-to-date information we were getting presented with, from wound care to asthma, and yeah, it was great to have that, and then step onto the ward with that up-to-date information.
For the theory, it's just hours and you have to attend all 10 workshops, and then we have some self-directed learning as well. So within those workshops and the self-directed learning, you do have packages that you need to complete, quizzes that you need to pass, and there are other theory requirements that you need to do. In the clinical setting, you're just working as a nurse and we're going to see your theory coming through there and you're getting back up to speed. We run those over 4 weeks, so that's how you can do your part-time option. So you could do your theory days over the first 4 weeks and then start your clinical, or you can partner up and do your theory and practical all in a week, and that's how you can get it done full-time in 5 weeks.
It took me about 6 weeks. I decided to do it full-time. My preceptor had a week off in between, so it took just over the 5-week mark, so more like 6 weeks for I decided to dive in and do it all in one go.
So you have to spend a minimum of 15 8-hour duties or 120 hours in your workplace, and you get assigned a preceptor who is a senior nurse who's done training to have a return to nurse, and they will be working with you for those full 15 duties, and at the end of that they need to feel confident that they can sign you off as competent against all the Nursing Council requirements. Sometimes, and it's not uncommon, you may need an extension, and it's not a bad thing. It just means that you need to have a little bit more time in that clinical area for them to sign you off as competent. What we try to do is match you into some previous work experience that you've had. So if you're primarily a surgical nurse, we would try and find you a surgical ward placement. If you had done district nursing, again, we'd try and match you with a placement that you're going to feel comfortable with, but sometimes placements are limited, so it may be that you have to go to where we have a placement available for you. We take anywhere up to about 15, so this year we had 13 on our course. Some ranged from being based in Wanaka to Dunedin to down here. So we'll cover the whole Southern DHB range to have people on the course. We only run one course a year, and that's in August, and it is again booked for August next year. So it's can be a long time frame if you say inquire in December and I say not till August, but in all honesty, sometimes people need that preparation time to get their families, organised or their jobs, and it gives them plenty of time to prepare. So we do enrolled nurses here, and we would love to see you applications come in, and we will help you get your certificate back and place you into all your registered nurses as well. Think about it, it is a big commitment. It seems a bit scary at the time, but certainly it's a great supportive program.
I understand for some people the course may seem intimidating and walking back into a nursing, but along with all the support staff and within the course, and then my preceptor on the ward, she was absolutely fantastic and really helped me find my confidence again, and taught me, and she was a great teacher, and there's fantastic RNs out there, and I just think, the whole experience was really good.
Being based in the DHB, we're one of only 3 DHBs that run the Return to Nursing program. The rest are done out of technical institutes, and I feel as though you really get a good look. We've got our nurse educators delivering the theory, so they're working with patients, they're then delivering the theory to you, and you get nice up-to-date current educators into the course.
The course was a lot less frightening than I imagined, and I think that was a nice surprise. You sort of wonder what will be, and like I said earlier, you're nervous about going forward with it, but we slipped in together and supported each other, and it was a great experience.